William, hopefully your favorite videographer from Two Hats Publishing. I welcome you to another Two Hats special of community events. Let's look in and see what's really happening.
Thank you very much. If we could take our seats, we will get started here. Good afternoon. I am Dr. Teresa Daniel, and I am your Dallas County Commissioner, I think, for almost everybody in this room. And want to say thank you for coming out on this warm Saturday afternoon, even though it is for an incredibly important topic that is, sad to say, maybe good news, bad news, increasing in interest. Would like to say that we do nothing by ourselves, and as you can tell by those people who will be presenting this afternoon, that we have Zach Thompson, who is a Dallas County star, as he is probably the person in the county that ends up being on TV and in the newspaper the most often. And he is our Director of Health and Human Services. And he will be talking about the monitoring and testing for Zika and other mosquito-led viruses. And then we have Dr. Emily Adikari, OBGYN from Parkland Hospital, and she's the Women and Infants Specialty Health, which is known as WISH. People, when they come to events like this, first of all go, what in tarnation is Dallas County doing? Because there is not much of an understanding of, okay, what does county government do? What does city government do? How does the state or the feds fit in? County government is, the two biggest chunks are public health and public safety. Public health is Parkland, because the Dallas County Commissioners appoint the board members to Parkland, and then also oversee the budget, and by statute have to approve certain kinds of decisions. But in addition to the main engine of public health in Dallas County, public health is also an incredibly wide stretch of services, ranging from nutrition services for the elderly, to services for pre-K, to immunizations for kids going to school, to the monitoring of a variety of infections and diseases, such as HIV, the TB, and then all of the mosquito-related items such as West Nile and Zika. 5-6 stories of public health. I mean, and we really appreciate all the services that Mr. Thompson brings and all the knowledge he brings to that wide spectrum of topics. The public safety part of county government are the jails and the court systems, and that's all the civil courts and criminal courts. And people look at when I put out items on the back table, there's a number of pieces of information, and I always put out a budget. And people say, well, why would you put out something? There is nothing more boring than a budget, except that on the second page, you'll see an organizational chart of county government, so you get a better idea of, in fact, how county fits into city, fits into state and feds, and how we all work together and complement each other. Also, the old adage of follow the money is still true, so if you follow where the budget goes, you will then see where county government goes. I start at the top saying we don't do anything by ourselves, and I really do appreciate my staff coming out today. Jermaine White is my chief of staff, sitting over here if you haven't met her. And then Erin Moore is executive assistant over here. And Emily is over here, and she does a lot of the other kinds of stuff that we end up having to do. I'm very proud, though, to say that by all of us working together, yes, in fact, we can accomplish a variety of good things, making Dallas County a stellar county in the United States. Whenever I travel around Texas or around the United States, I am always encouraged and heartened that, in fact, yes, Dallas County has taken a lot of the hard issues, the hard questions straight on, and not perfect, but definitely contributing very positively to where we do, how we do business and where we're headed. Without further ado, I would like to introduce Mr. Zach Thompson, who has been with Dallas County a number of years, and he will share some of that information with us right now. Thank you, Zach.
Thank you, Dr. Dunn. Good afternoon. This is a very timely subject, especially what we are viewing in Florida. So I wanted to put it in the context when we start talking about Zika. CDC had started meeting with local health departments to talk about Zika and the impact it would have on the United States. And so you can see early discussions started as early as January. Some discussions were starting last year in terms of looking at getting local health departments prepared and also providing information to the general public regarding Zika and Zika prevention. One of the things that we're focused on in terms of the guidance, in terms of the interim guidance, and people really did not follow those recommendations, is that people should postpone travel to those endemic countries where we're seeing the Zika outbreak. Now, I can repeat that 20 times and it won't mean anything to anybody because they're going to still travel there. The amazing thing is that when you have such an outbreak, when it's categorized as an epidemic and people travel because they got family there, they want to vacation there, when you run the risk of bringing the Zika virus through humans to the mosquito population in the United States. And I want to differentiate between what we see with West Nile virus as well as Zika virus. So I wanted to make sure the point is clear. People will say, are y'all trapping for Zika mosquitoes? We can't trap for the mosquitoes until we find the human confirmed case. The humans are bringing the Zika virus to the mosquito population in the United States. So let's talk about mosquitoes. There's a lot of mosquito trapping going on. And when you look at the data here, and it's on our website at Dallas County Health and Human Services, all of our municipalities are doing a great job in terms of trapping for mosquitoes. If you got questions about trapping in the city of Dallas, you have to contact the city of Dallas because they're responsible for mosquito trapping and spraying within the city of Dallas. But we work closely with the city of Dallas. If there's an area you want to have the city of Dallas look at, you can jot that down and I can definitely get that to them to make sure that they review, set a mosquito trap, and do the surveillance that's done there. Right now, we're looking at a large number of mosquito traps coming back positive. Let's go back to 1999 when we first saw the first West Nile virus, and I'll get to Zika. The first West Nile virus was discovered in New York. And so when we, in terms of the United States, in 2002 is when we saw the first West Nile case in Dallas County, 2002. So let's fast forward to 2016. 1999, New York, 2002, Dallas County. There's still not a vaccine for humans. And so as devastating as West Nile is, there's still not a vaccine. And so there is a vaccine for horses, but none for humans. So go figure. The concept is that when you look at the number of people who get West Nile neuroinvasive, West Nile fever, and so not to have a vaccine. So you don't have a vaccine for West Nile virus, you don't have a vaccine for Zika, and how deadly West Nile can be, and now the birth defects associated with the Zika virus, and that's why it's critical that we always point that out. That being said, the only options you have, and we're going to talk about this over and over again, is to remove standing water, dress appropriately, use DEEK mosquito repellent, And that's your options in terms, and the ultimate option that we would have to look at is two options would be ground spraying and aerial spraying. So those are your options. And so we point that out over and over again because it's real critical to point out is that the responsibility is going to be on the citizens to use mosquito repellent to make sure that there is no breeding sites in their area. And I'm going to give you an example. We've been doing this a long time. I can go out to communities, we can take our mosquito experts out, and in some communities, we cannot find where these mosquitoes are breeding. And in some areas, they are up, in some traps, they can be up to 3,000 mosquitoes in one trap. And I won't name the area. We go there every year. We can't figure it out in Dallas County. We went into one city, and there were 1,000 mosquitoes in this one trap. And we said, let's all take a chance. The city took their staff out, Dallas County staff, and we went and we tried to find the breeding site. Could not find the breeding site. There was one house that the shrubbery was growing from the foundation to the street. You know what we said? That's it. They had a swimming pool in the back. We said, we found the breeding source. Set mosquito traps, that was not the breeding source. It was just one area that definitely needed to be addressed, but that was not where we were seeing the abundance of mosquitoes. So when you look at the vector index, when you look at our human cases, right now we're at 14 human cases for West Nile. We're at 21 cases confirmed for Zika imported. I always want to be clear, imported cases. We do not have any localized transmission to humans from the mosquito population as of yet. And so the key point in this is that we have to encourage Dallas County residents to make sure as they return from those endemic countries, if they have symptoms, they go to their primary physician, and that can be reported, and we can do the mosquito surveillance and mitigate the potential for the mosquito spreading the virus if the mosquito happened to bite that individual. These are all our cities that are doing traps. I just want to kind of point out the full array of cities that are doing trapping. In some areas, in the city of Dallas, you see large numbers of trapping that they're doing each week. They're doing 90 traps every week in the city of Dallas. They're fixed traps. And so that's different than what we were doing back in 2010, 2011, 2012. Basically, they were moving traps around. Now we have fixed traps that give us an opportunity to be able to do the ground spraying consistently, and we have good data. So what you're seeing is all our cities are participating, all our cities are asking the questions about what they can do to help their citizens. And one of the best options that our cities chose to do was to be able to do ground spraying within 24 hours. That's 8 to 24 hours. Now, citizens balked against that. I want to be clear. Some citizens want more notice. We got that. We understand that. We're all for the notice. But the key point is once you've identified a positive trap, we need to do the knockdown immediately. And that's why we try to do it within 24 hours, but definitely within 8 to 24 hours, we want the ground spraying to target. Because quickly, if you're looking at the number of mosquitoes that they're collecting, we have to do a knockdown very quickly. And so you can see the positive traps all over Dallas County. These are positive traps. Where you see pending traps, we're working now to try to get most of our cities to start sending all of their traps to Dallas County, but some cities send their traps to the state. So any pending mosquito traps are at the state lab. The difference is our labs turn around mosquito trap results within 24 hours or less. If you wait on the state, that's at least, and I know we're taping, they know I say this, it takes 2 weeks. So the concept is the quicker we're able to get a positive trap identified, the quicker we can move toward the ground spraying, and that can knock down the potential for infection by mosquitoes for West Nile. Again, these are all data that kind of shows you the tracking of the Culex mosquito, and I want to get to the Zika. Again, we focus a lot on the West Nile because West Nile is still the number one enemy in Dallas County is the West Nile virus in terms of the Culex mosquito. These are the countries, and I think some may have been added, that our Zika transmission has been identified. And what's amazing is that all of those countries, people travel to, they're coming back into Dallas County. And so when you look at these countries of origin, these individuals are going home and knowing that the Zika virus is at an epidemic proportion in those countries. And they are getting bitten by mosquitoes there. They are traveling back here. The issue is most may be asymptomatic. And so by the time we may find out that the person has been confirmed as a positive Zika case, they have already been mingling around in their neighborhood. And so by the time we get the results, that may be 2 weeks after the person has already been here and been in a symptomatic phase. And so that's a key point that we really have to focus on. By the time local health departments find out that the person is positive, they have already been going to work, they've already been working in the yard. And so that's the concept that we have to deal with. It's after the fact. So you keep hearing me say the same message. Don't go home, postpone going home, because the concept is if you got family there and it's saying that there's an outbreak, that's the key point. And by bringing it here and transmitting it to our mosquitoes, and you probably never heard me say this, but I gotta say it this way. We gotta protect our mosquitoes from Zika. So the only way we're gonna protect our mosquitoes from Zika is from humans who don't bring it back, do not bring it back to our country, and that's the only way it can be transmitted. Recommendations, again, I just pointed those out. DEET, all day, every day, mosquito repellent. People ask about all other gadgets that they can use to protect themselves. I don't get into those discussions. DEET, mosquito repellent, and the percentage is on the label, and that's what you can use. I don't know about all these other gadgets, but we do know that the mosquito repellent is working. Plus, wear long, loose, light-colored clothing outside, and I know Dallas County citizens are on top of it, because I went to get gas the other night and I had on my shorts, and they scolded me for that. They said, she said, "Where is your long pants?" I said, "I was just running out to get some gas. I'm going back in the house." But I do have on my mosquito repellent. So that tells me that Dallas County residents are getting the message. Drain and remove standing water around your home. And again, limit outdoor activities dusk to dawn. And then travelers who are going into those endemic countries, make sure you protect yourself. And then the key point on this is that we talk about two types of transmission. One is through mosquitoes, and the other is through sexual transmission. And so the recommendation on that aspect is to make sure, and they talk about not having unprotected sex for up to 6 months, and that may vary. The amazing thing when we talk about Zika, by the time we finish talking about it, there may be some new guidance that may come out, but that's the recommendation as we know it today. And so to talk about mosquito bites is an interesting subject. And people always ask, what is Dallas County doing? And as Dr. Daniels pointed out, it's a partnership. We're focused right now, we're geared up to look at aerial spraying based on letters from our cities. At this point, we've received several letters of interest. None have just committed to say that they're ready to move forward, but they have shown interest that they are ready to move forward with aerial spraying. I will say that as we get into August and mid-August, again, if we're not moving forward, there may be some questions about when we should take action in terms of aerial spraying. We think the information in terms of providing accurate information, and ground spraying is working, but in some cases we need to focus on if we're losing the ground in terms of spraying, then we have to go to aerial as the last resort. I showed you the map that shows all of those areas where we're seeing positive mosquito traps. And so if those cities feel that they cannot handle the response to the positive traps, then we have to go to aerial. So I wanted to point out, I know there's a great debate about aerial spraying, but we really found out in 2012 that everything that everybody said would happen did not happen. So we really should be focused on that as a last resort. And so we have that in our arsenal. We will only use it based on those cities saying that they want to do it. And so I think it'd probably be easier to pause here and go to our great partner in terms of Dr. Daniel. I'll turn it back over to you. I guess Parkland has a presentation. There's a lot of information. I might not have covered everything that you wanted to talk about. I will say we're up against, in terms of those mosquitoes, you're talking about thousands and thousands of mosquitoes. You're not going to eliminate. I was in Austin. I had a state representative say in a public hearing, how come you just can't kill off all mosquitoes? That's not going to happen. And so at the end of the day, they are a part of the ecosystem. We have to look at what's causing the large amount of mosquitoes. And last year we had a large number of mosquitoes that were reported in our cities, low infection rate. Right now we're seeing a large number of mosquito positive traps. We've only had 14 cases confirmed to date of West Nile virus. No, unfortunately, that's sad, but the bottom line, we've not had any deaths to date, and so that's a good thing, and I hope we can keep that up. So I'll turn it back over to Dr. Daniels.
Thank you very much, Director Thompson. Well, now I'd like to turn to Parkland, because obviously this is, Zika has shown to have some particular characteristics and qualities that are largely unknown up to this point. A lot of research is being done. So we'd like to have Dr. Emily Adhikari come up. Would also like to recognize that once again, we do nothing by ourselves. And with her, she's got Marjorie Quid-Boucide, the Vice President of Nursing at WISH, plus Catherine Yoder, who is the Vice President of Government Relations, because it is all of us working together at these things. So now let us hear another aspect of the Zika by Dr. Adhikari.
Hi, and thank you for having me. I have to thank Commissioner Daniel for hosting this forum. I think this is very well timed. We all probably have been hearing in the news that there are some reports of Zika virus that are now in Florida that are potentially from local mosquitoes. And so I think this is a very important event to have, and I think we may need to have more in the future to inform the public about Zika virus. I work with a team of physicians in the infectious disease prenatal clinic at Parkland Hospital, where we care for, among many other types of infectious diseases, we care for all women who have had evidence of Zika virus during pregnancy. As of today, we have not had any local mosquitoes, as Dr. Thompson has said. We have not had any local mosquitoes in Dallas that have been shown to have Zika virus, but we at Parkland have prepared for that possibility. And so I'd like to talk to you a little bit about the program that we have set up, the screening program that is currently to screen women who have traveled and that may need to be evolved over time if we do have mosquitoes in Dallas County with Zika. Before I talk about this slide, I would like to direct you to a handout that Parkland has provided. In the handout, there's an English and a Spanish, and it describes the Zika, the modes of transmission that we know from the Aedes mosquito. It also describes the symptoms that can be sometimes associated with Zika virus infection. And it states, again, that there is currently no treatment for Zika virus, and there is no way to prevent Zika from affecting a fetus. There is no vaccine, as we know, for Zika virus. But there are preventive measures, again, to reiterate what Dr. Thompson has said, there are preventive measures that we can take and that pregnant women should also take to prevent mosquito bites. It is important from our perspective, it is important to spread the word that we consider DEET to be very safe in pregnancy, and we encourage pregnant women to use mosquito repellent with DEET to prevent mosquito bites. This first slide is an example of the risk of microcephaly, or a baby that has a small head, in a country that has local transmission of Zika virus. So I think the most important thing when we talk about Zika virus here in North Texas is to put everything into perspective. So first, it is important to know that we don't have Zika in our local mosquitoes, and we're trying to prevent that from happening. But in everyone's mind is, what happens to my baby? In women's minds, anyway, in our clinics. And so in a country where there is frequent local transmission of Zika virus, such as in South America, Central America, some in Mexico, but not as often as what we have determined in our patient population, there is a risk of a baby that has a small head, and that's called microcephaly. There are other risks associated with Zika virus transmission to the baby. We're learning about a congenital Zika virus syndrome that may be associated with other brain abnormalities, not just microcephaly. But what is the risk? If microcephaly is something that everyone is afraid of, it's important to, I think, spread the word that the risk of microcephaly is actually fairly low in a country where there is local transmission. However, when there is in a country with local transmission, for example, Brazil, El Salvador, or something like that, there is no mosquito control like we have here in Dallas. There is no air conditioning that can help prevent mosquito bites, and people don't spread the word and use repellent as we know to do now here. And so when you have a lot of people infected, then that 1%, as I will describe to you, ends up being a lot of babies. So this slide shows you that in a population, it is thought that the infection rate of Zika virus in a country may be about 60–70% in countries with local transmission. Of the 60–70%, only a small proportion of those people are pregnant women, right? Of those pregnant women, the risk of actually having a baby with microcephaly turns out to be about 1%. So the risk itself is low in those countries. The problem ends up being, I think, a matter of infection control, so mosquito population control and use of mosquito control techniques. So back in January, February, we at Parkland began to hear about reports of Zika spreading. We listened to the CDC alerts, and we began to prepare for a program where we can determine what the risk is for our population. In our program, we began to screen, starting on March 14th of this year, we began to screen every pregnant woman who comes to a Parkland prenatal clinic for travel, because as of now, the risk of our women getting Zika virus depends on whether or not they have left the country and traveled to a country that has local transmission of Zika. So now our current program is built around whether or not our women have traveled. So that is the first screening question that we have. And then subsequently, we do ask about symptoms. If they have traveled, then have you had symptoms of the virus? Now, we do know that the majority of infections are asymptomatic, without symptoms. And so that doesn't mean that that woman is risk-free if she has not had symptoms. For those who travel during pregnancy, we start with a blood test, which is sent to the Dallas County Health and Human Services. We work closely with them on a daily basis, and I'm in contact with them almost every day about samples that we have. That's how we start. We also have an ultrasound that is specifically for women who have traveled that we perform within the next few weeks to evaluate the fetus. Because as we know, some infections are asymptomatic, but it doesn't necessarily mean that the fetus would not be affected. Now, currently, the system is set up at Dallas County that we are able to get results back within a number of days. And so we find out which women are at risk among those who have traveled. And those who test positive get a little bit more evaluation. They get referred to our infectious disease clinic, which is centralized at Parkland Hospital, and they get more testing, of course. They have a more detailed sonogram done to evaluate the baby with attention to the central nervous system. And we follow the growth of the baby during pregnancy because Zika has been associated with poor fetal growth as well. Eventually, at the time of delivery, we are in contact with all of the physicians at Parkland who track the patients, and when they get to labor and delivery and when the baby is born, we do a little bit more evaluation. And we send certain things to Dallas County at the time of delivery because we are still learning about this virus. Subsequently, we are in touch with our pediatric colleagues, and they do evaluation of the baby. They do a very specific exam. They do evaluation, they do a head ultrasound in certain cases, and they may do a blood test for the baby. And subsequently, they have a special clinic that is set up for those babies who are born to mothers who have had evidence of Zika virus during pregnancy. So far in our program, up to now, starting in March, we have screened over 10,000 women from our prenatal clinic system. Of those more than 10,000, we have found that about 350 or so have told us that they have traveled at one point or another during their pregnancy to a country that is listed by the CDC as having local transmission of Zika virus. Of those 350, we have found about 21 women who have at least preliminary evidence of possible Zika virus infection during pregnancy. And we are waiting on some more testing that comes from the CDC, and there's certain delay, but we act as if that is a positive case until we get negative confirmatory results. Among of those 21 women that we are currently tracking in pregnancy and in our infectious disease prenatal clinic, 18 of those women have traveled to Central or South America as opposed to Mexico. So what we are seeing at Parkland currently is that there is much more local transmission from the Central and South American regions as opposed to probably northern Mexico, where our patients may tend to travel, and most of them travel to Mexico as opposed to Central or South America. Only about 6 of these women have had one of the 4 classic symptoms that may be associated with Zika virus. So the majority of these women were asymptomatic, and we found out by doing the lab testing. It is important to understand that out of all these cases, we at Parkland have not had a case of microcephaly among these women, and we have not found on prenatal screening or ultrasound any cases of babies that have had severe brain abnormalities so far. Okay, we continue to track women who come into our prenatal clinic system, so every day our information evolves. And but I believe it is important and reassuring somewhat that we have not had any major cases of infants with severe sequela from Zika virus so far. We do not have yet long-term outcomes on these babies, so we will continue to look at the follow them in a clinic to determine if there are longer-term problems that Zika may cause. And I think that is about it. Question? Yes.
How do you measure temperature for fever? Subjects that you're looking at for Zika. Do you read out once a day, twice a day, once a week?
So typically the course of the natural course of a Zika virus infection, most commonly the 4 symptoms that are associated with Zika virus are rash, joint pains, fever, and conjunctivitis or irritated eyes. That course tends to last only up to about a week in most cases, and then the symptoms go away spontaneously. And so from our perspective, the majority of our patients come from Central or South America. If they report Zika symptoms, it's in the past. They no longer have any of these symptoms. And so there's no indication that we need to continue to screen for fever because they're no longer having the symptoms.
Do they ever have low-grade fever?
Continually during pregnancy, that's not been a symptom that is found to be a classic of Zika virus in particular. It may be that during that first week of infection, when they had symptoms, it may be that the fever was low grade as opposed to higher.
Yeah, I guess I'm wondering if during the week or the week before, or the week after that being middle week, because then there's no week.
We have not had a woman who comes with, a pregnant woman who comes with acute Zika virus infection. That is to say that she is within that first week of her infection and exhibiting classic symptoms. We have not had a pregnant woman who comes with us, comes to us with those symptoms yet.
Yes. Is there any plans for, in the near future, to ramp this up if there's, say, an outbreak of incoming, say all these people come back from the Olympics and there's all of a sudden a large influx of travelers here to DFW, how, is there some kind of plan for what should they do? Should they go immediately to see their physician or the hospital?
Well, that's kind of both of you.
Before we start out, yeah.
Well, I'm going to echo Dr. Thompson. I would recommend that any woman who is pregnant or considering pregnancy, anyone who is in her family that would have close contact with her, a spouse, a partner, not go to a country with Zika virus locally transmitted currently. That is our recommendation. And as far as our prenatal system, if we have local transmission of Zika virus, then we have a Zika team that is prepared to change the algorithm that we have set up currently. Instead of screening for travel during pregnancy, we may incorporate some amount of testing locally at our prenatal clinic system so that it's an automatic, potentially, the CDC recommends considering automatic testing at the first prenatal visit for having been exposed if there is local transmission.
And so on our end, the challenge is going to be the actual mitigation. So we would have to look at where this confirmed case is located. Confidentiality comes into play, but of course, what you're seeing in Florida is that you want to protect the confidentiality of the patient and their family. And so really, you have to do mitigation almost up to 150 yards in that neighborhood. And so we know confidentiality goes out the window at that point. But basically, we physically have to go to every house in 150 yards and ask permission to be able to come into their yards and do the mitigation. That means up to spraying or fogging. And we have to notify the police department, the fire department, because once the foggers start going, they're going to put out this heavy smoke. And so we have to notify the residents. So you can already see that on birth defects, that's traumatic, and that's an issue. On our end, it's going to be traumatic for that neighborhood because those individuals who are in that neighborhood, there may be other pregnant mothers in that neighborhood that we're going to have to do a lot of education on. So this has a big ramification in terms of response. But as you can see in Florida, the disturbing piece is they're saying they're looking at for the mosquitoes, and they've not found a positive mosquito for Zika. So again, that raises the alarm in that area.
One more kind of follow-up question. I'm understanding from the news media that the Congress took the recess without funding the Zika, I guess, directives that how are we going to do this without any kind of money? If there's somebody from the Dallas County?
It's us.
That's right.
Okay, thank you.
Because in fact, Dallas County has invested in the testing machinery to identify this. Because we did recognize that it's so important to our community and our populations to be able to identify that. But you're right, it gets pushed on to local people. But on the other hand, the Commissioner's Court feels very strongly that that's our role, public health, public safety. That's what we do. And if Zika is in our community, then we take it upon ourselves to step up and do what we have to do. We're always asking for a partnership with the feds, the state, or whoever can help us, CDC and a variety, I mean, any place that we can figure out, but no, it's important enough for our people. So we're stepping up.
Two examples of that is with Dr. Daniels and the leadership on the Commissioners Court was we increased our staffing for mosquito control thanks to the Commissioners Court, and we also have added a mosquito contractor to focus on Zika surveillance and the ground spring. So I guess if we waited on Congress to wake up, the mosquitoes woke up before Congress. So the concept is that when you look at it, the Commissioners Court is already invested knowing that our Congress will do what they normally do.
I would also like to say, too, that there has been a little flurry in the news this past week related to aerial spraying, and that we had signed a contract with the aerial spraying company. But in my view, that's being prepared. It doesn't say that we are doing that today. All it says is that if we do need to do it in the future, that we have set up the procedures so that we can do it and we can move quickly enough in the time frame that Mr. Thompson has described as being optimal. When you hear about it, you get out there and you do something about it. There will be an awful lot of community education, community notice, in any way that we can do that. And we by now have a number of, whether it's in the news media, getting out the word, of directly going to homes, households in the area in order to alert people to what's going on, so that if they do have concerns of particular methods, that they can take appropriate action on it. But I don't think that lessens our responsibility as those in charge of public health not to be prepared, not to be ready, not to do the research and do the proper testing at the hospital, not to have the machinery available to test mosquitoes, and not to have the contracts in place to do what we're going to need to do. I just call it that's being prepared and being fairly realistic. You know, as Mr. Thompson said, if we waited on Congress to act sometimes, that swiftness is not there. So we've got to watch our own people, our own populations, our own situations. And fortunately, I think that between all of the good partners that we have, that we're putting into the groundwork of being prepared. Are there other questions? Yes, ma'am.
Hi, Dr. Victoria, I have a question for you. So you said that part of the screening is screening for those who have traveled to those areas. So is there, I won't say like a backup, but have you had a situation where during the screening they didn't divulge that information, but later on it came out that they have traveled? So in those types of situations, I guess how are you guys prepared to handle that sort of situation?
The answer is, of course. We see everything at Parkland. So in situations, we have to simply rely on our patients to trust us enough to tell us, because it is part of our initial prenatal care visit. If patients subsequently decide to not follow the recommendations and then subsequently travel to a country that has had Zika virus, we have given them a similar information sheet, but then that requests that they inform the healthcare provider if they subsequently travel. And we have had a few cases that have chosen to do so. And so we actually rescreen that patient. We have not had many of those because we are very clear in the recommendation not to travel during pregnancy to a country with Zika. And that if that happens, we need to know about it. But there's not it happens at the first prenatal care visit so that that patient has that knowledge to stay safe for the remainder of pregnancy.
Are there other questions? Yes, ma'am. How long do people transmit Zika?
It's a good question. I think we're still learning because there are different modes of transmission. So there is an initial period where the virus is in the bloodstream, but we're learning about the virus being in other bodily fluids, such as in semen in men and in urine. And so depending on the bodily fluid, it can last in different cases for longer periods of time. Additionally, in pregnancy, there has been a case of a woman having the virus in her bloodstream for a much longer period of time than we had previously thought. And so there is some thought that the Zika virus the placenta in pregnancy may be a source of continued viral replication in some women. Now that's a case report, so that doesn't mean we know everything, but we're still learning about how long the infectious period can be. But the recommendations by the CDC are for people who travel and who are thinking of pregnancy, who are not yet pregnant, for couples, if the male has symptoms of Zika virus infection, because of what we know about Zika virus, the recommendation by the CDC is to wait 6 months before attempting pregnancy. For a woman, that recommendation is 8 weeks. And if patients travel, if a couple travels but does not have symptoms, but they travel to a country with Zika and are thinking about pregnancy, the current recommendation is to wait 8 weeks before attempting pregnancy.
Yes, ma'am.
How long is it symptomatic?
For usually less than a week. The symptoms usually resolve completely within a week. I would say that.
Is there anything else? Yes, sir.
Kind of in the way of rumor control, I don't know whether this is true or not, but I heard the media outlets talking about some cases in Utah where the actual personnel in the hospital may have been picked this Zika virus up from dealing with patients that had it. Is there any validity to that, or what do you do to protect your own workers if their apartment may be different, or say the first responders and things like that?
My understanding of that case, and I don't know the most about it, but my understanding is there was a patient who had a viremia or virus in the bloodstream, who had a very high viral content in the bloodstream, and that a caregiver subsequently acquired the infection. It's not clear. I don't know all the testing that was done. I imagine that if you're a caregiver, you are in contact with bodily fluids on a fairly regular basis. So I don't know what the thought is or what the test results are, but that's my understanding of that situation. It was a patient that had a very high viremia, but it was a person in close contact, so who knows what bodily fluids were there.
Any other questions? I want to say, first of all, thank you very, very much, Zach Thompson of the Dallas County Health and Human Services, on bringing your portion of the testing for Zika, and Dr. Ayakari talking about the human part in children. Once again, we do nothing by ourselves, and I want to say thank you very much to Colleen Smith and the City of Dallas Library System, because it is with all of us working together, the cities, the counties, and everybody else, where we are able to do a better job at informing the public and hopefully controlling some of the issues that can be problematic in our communities. So thank you very much, and our videographer here to make sure that we are documented to say yes. Dallas County is ready, Parkland is ready, City of Dallas is ready, and the other 25 cities in Dallas County to see what we can do to make our community a better community. So give your own selves a round of applause. Thank you very much for coming out today.
This is William, hopefully your favorite videographer from Two Hats Publishing. I hope you enjoyed this video. If you like it, please leave comments below, or like, follow, or subscribe to us and get notices of all our videos. We love it, even when you call.